Can you make a video about a lateral shift? Why, yes, I can. In fact, it's going to be the same video as the lateral pelvic tilt, folks, so let's get into it. First thing, what is a lateral shift? A lateral shift, if I can grab Ted to show us, is essentially when you have a functional, and I hate using that word, but a functional scoliosis that occurs due to some type of back issue. It can happen in acute low back pain. It's oftentimes associated with disc injuries, but again, not always. But essentially what will happen is that person will have the top half of their body shift one direction, and then the bottom half of their body will shift in the opposite direction. And it gives kind of this lateral side shift appearance. It can happen to either side of the injury, and it's very common in acute low back pain incidences. Now, before you go thinking, okay, well, I'm going to go do this, and this, first off, disclaimer, folks, get yourself checked out, because if you have any disc type injury, you're getting stuff going down your legs, you got weakness, foot drop, anything like that, you need to get evaluated by a doc to make sure you don't have anything drastically wrong, because that shift may actually be protective. If I devise some type of shift, it might help offloading the structures that have been affected. And especially if you're getting some symptoms that are undesirable, you may want to get that checked out and get it taken care of. Doesn't mean you got to go get surgery right away. Sometimes you might have to. But in some instances, doing some type of high-dose anti-inflammatory can be really helpful to reduce some of the acute inflammatory process. Because what you don't want is nerve compromise with these things, because sometimes that can happen, especially if you're getting stuff going down the leg. So please get checked out if you got this. That being said, let's assume that, okay, you got checked out, things are hunky-dory, it doesn't seem like there's anything structurally wild and crazy. What the heck do you do about it? Well, first we got to look at, from a movement perspective, what is likely going on here. And it actually ties back to the lateral pelvic tilt discussion that we just had. If I have any type of side bending activity happening, we have to look at, when does side bending happen from a gait perspective? And generally, more of this frontal planey kind of stuff occurs at mid-stance. Mid-stance is associated with internal rotation. If you got some type of lateral shift occurring, chances are that is the body changing its orientation to try to get into a position of internal rotation, or to offload an area that is internally rotating too much. We can look at it as either of those ways. And in fact, to illustrate this point, I'm going to walk you through a case that I had that presented with this particular deficit. So this person came to me, and I've seen him a couple times before. He's had on and off back pain. I'm just going to pull up his notes. And it was doing really well, but he took a swing of his club and his back was a little iffy. And he presented to me with this cray-cray lateral shift. His thorax was going to the right, his pelvis was going to the left, and it took him a hot minute to get up. And normally, this particular individual presents with a loss of IR, range of motion. He's a narrow infrasternal angle. And it was very significant on the left in particular. His left straight leg raise was limited. So in this case, he was shifting his thorax away from that restriction. So limitation in straight leg raise associated with pain, which is very common with someone who has a lateral shift. If it was on the left and he shifts away, that's to reduce the internal rotation contribution on that left side. And so the straight leg raise was associated with pain, could not touch his toes, wasn't happening. Those were the big deficits. And so if we look at what I did to help him, most of my interventions were to try and find ways to get him to create internal rotation on that left side, but to do so by restoring relative motions at all the respective joints. And what I did was I did a manual technique where so I got Ted on my shoulder. I took my hand And so his right hip is on top, left hip is down low. And I started pushing the sacrum to the left. So that way he could load into the left side. He had about 60 degrees of hip flexion in this particular instance. So it's just to slowly get him to turn his body and start loading into that left side. So if we look at this from a gait perspective, if side bending occurs mid-stance, this sacral turn move that I did was more of an early stance-based intervention. So you have to get the early before you go into the mid. So I started with that first. From there, then I did a 90-degree hip shift passively. Just like I talked about with the active hip shift activity in the previous question, I just did a passive variation of this. So I had him lying on his right side this time. Femurs were out here. I pushed the femur back, pressed down. So that way, now we were starting to introduce a little bit more internal rotation. So I did those two moves, hung out for a little bit, and we saw what was crack-a-lackin'. After he got up with those two things, the shift was reduced, but it wasn't perfect, and he was feeling better. And I do want to preface in this particular case, he didn't have any symptoms going down the leg, so you don't always have to have discogenic symptoms with these particular presentations. Then, folks, I kept going. Now, we talked about only one component of this mid-stance, which is the pelvis essentially being able to shift or laterally tilt, in this case, to the left. But that's not the only thing that has to happen, folks. You also have to be able to get the thorax to tilt to the left. And so what I did in this case was I actually did some stuff to promote lateral expansion of the rib cage as well. And I did this on the right side because I needed him to open up that side. He was shifting and clamping down on the right. So I actually did things to open up that side. So I did some lateral expansion manually just because he was in an acute instance of low back pain. I didn't want him to do too many wild and crazy movements. He got up and the shift was almost completely gone. I was so pissed because I didn't take pictures of it because it was such a dramatic change for this guy. And he was feeling a lot better. And in all of those instances, all of those moves were to try and get the internal rotation strategy back that he was lacking. And then some of the activities that I gave him from a home perspective was to just do some, basically some passive ways of getting the same thing. I had him with a bolster underneath his left side. We did some stuff where I had him foam roller pushing into that left sacral turn. I had him doing some hip shifting activities in that particular instance. And he did those couple things and was feeling pretty good. So based on that, and based on what we know with what's going on movement-wise with the shift, the name of the game is getting internal rotation strategies back. And what's going to be your friend are two things. One, teaching these individuals to be able to shift their hips, likely towards wherever they're lacking. Use your measures to be your guide. If you have someone who's got a limitation in straight leg raise and a loss of IR, you're probably going to teach them to shift into that particular position. Not just at the pelvis, but also at the thorax. Anything you do that's going to create lateral expansion of the rib cage is going to be really useful. And if you can focus on those two qualities, a lot of times that can help reduce the shift. And I've gone with that more so than any type of lateral shift corrections. And I've found similar results and efficacy. So the big key, if you see lateral shifts, is to teach those individuals to be able to restore internal rotation-based measures, assuming that they have the ER measures first, because you have to be able to get those before getting into the IR stages of things. And the reason why that is if we look at my wonderful cup of water that I have here, internal rotation occurs kind of in the middle of the cup. You got to be able to fill the bottom before you get to that side of things. If you do that, you ought to be less shifty.